Okay, so the question is, do pigs fly? That's what I was asked during a live call-in talk show that I hosted many years ago when I first got into TV. And this will tell you how old I am. Does everybody remember when we used to have phones and you had a line that you actually clicked on the line, right? Remember the old phones? Does anybody not know what I'm talking about? So this call-in talk show that I was hosting, it was like you click, hi, you're on the air, hi, you're on the air. And this person said, he called in, and I think we were talking about something scintillating, like watching paint dry at a city council meeting. And somebody called in and he goes, there's just one question I want to ask. And I said, what? And he said, do pigs fly? And in that moment, I thought, I love this business. It is live, it's unpredictable. And in that split second, I thought, what's important? Well, I've always thought that the facts were important. So, do pigs fly? I said. Not on this program. Click. In the 30-plus years that I was in television, the program has changed a lot. There used to be just 3 networks, and now there's 1,000 channels to choose, thousands of channels actually, to choose from. TV survived the web and Twitter, Facebook, smartphones, apps, and all the other distractions that were predicting the demise of television news. Hasn't happened. When there is a big story, as you noticed by watching television of late, people are still turning to TV. Viewers may also be tweeting and surfing the web, but TV remains a draw. But after 3+ decades in television, my priorities actually were drawing me in a different direction. I had spent most of those years working until midnight, pretty late, because I was anchoring all the evening newscasts. Pretty late in the game, I had gotten married and had a child, and those late nights were taking a toll on my family. But if you told me 7 years ago that I would actually be here today, having given up the profession that had defined my adult life that I had spent more than 30 years in, I would have said absolutely not, no way. But life has this funny way of surprising you, and my surprise began roughly 8 years ago, and it started with the phrase, have a nice surgery. Those were the last words that my 9-year-old son said to his grandpa, my dad, in December of 2008. My dad, it was before his open heart surgery at Scripps Memorial Hospital in La Jolla. Dad's aortic valve was on its way out. He had no choice. He had to have this operation. So the surgery went really well. The new valve was working perfectly. But for some reason, the left side of Dad's heart was not, both sides of his heart were actually not squeezing in sync. So the left side was squeezing too strongly. The right side was very weak. 1 minute his blood pressure was through the roof. The next minute it was dangerously low. And this is the biggie. They couldn't close his chest. When open heart surgery is done, the very last thing that the surgeon does is that they knit the bones back together with wires, and then they close the skin over the chest. So when they tried to do that with Dad, it put too much pressure on his lungs and he started crashing. Dad was on the operating room table for almost 48 hours, too unstable to move. This is not a good place to be for that long a period of time. All kinds of things can go wrong. Multiple organ failure, massive infection, but none of that happened. And so Dad's surgeon, Dr. Donald Buehler, one of the most highly courageous and highly skilled people on the planet, decided to leave the chest open. It was a little half-inch gap. You couldn't see anything. It wasn't grotesque. How do I know this? Because while Dad was still in the OR, in a medically induced coma, a nurse came out and she asked us if we wanted to go in and see him. I thought that this was incredibly bold and very kind. So for almost 2 months, Dad stayed in that coma while 80 phenomenal people worked 24 hours a day to keep him alive. The critical care nurses, led by the spectacular Trish Ragg, would turn Dad's body every few hours to make sure that he didn't get bed sores. They let us bring in family pictures and Dad's iPod, and I will forever have etched in my memory the sounds of Dad's favorite composers, Beethoven, Mahler, Rachmaninoff, enveloping him, punctuated by the low beeping sounds of all of those machines that he was hooked up to. Periodically, our son would ask to see his grandpa. And about 6 weeks into it, that sweet little 9-year-old boy looked up at me and he goes, "Mom, my grandpa needs to see me." And yet in another bold act of kindness, Scripps let us wrap up our son in a sterile gown. And I will forever have etched in my memory the image of that precious little boy holding his grandpa's hand. And it obviously still gets to me today, how many years later. But the question was what to do with that half-inch gap. So what they did was they took Dad's left pectoral muscle and they moved it into place. And then they took his right rectus muscle down by the rib cage and they moved it into place. And they fashioned a flap, basically, to cover that half-inch gap. And then we all held our breath as they never knitted the bones back together. Then we all held our breath as Dr. Bueller then closed the skin over the chest. Hold on a second. So they fashioned this flap to cover the heart and fill in that gap between the bones. Every night I would send out this mass email to friends and family, and one night I got an email back from my cousin in New York, and she was retelling this wild story of Dad at a cocktail party, and one of the people interrupted her. It was a doctor, in fact, who said, "Oh, that must be Scripps. They're known for that kind of innovation." It's my understanding that this kind of surgery is very rare. It is the Hail Mary pass of heart surgery. It is what you do when there is nothing else left to do. In February of 2009, Dad was transferred to Scripps Encinitas to their inpatient rehabilitation wing. So when you're laid out for so long, you lose 2% of your muscle mass. The body loses 2% of its muscle mass every day, so you do the math. When Dad entered rehab, he was basically like a 2-month-old baby, having to learn how to do everything again, having to learn how to sit and stand and roll from side to side, lift his neck, squeeze and grasp. Dad was on a feeding tube for 4.5 months. And when he finally passed his swallowing test, the voice and swallowing coach said, "So, Bob, what would you like to eat? Your first solid meal." His reply, "Costco hot dog." And you know what? Nobody asked her to, but she went to Costco and she got it for him. Every week, Dad's neurologist, Dr. Michael Lobatz, and his team of physical therapists, occupational therapists, voice and swallowing therapists, social workers, nurses, caseworkers, they would meet with us to track Dad's progress. Can you imagine that? The entire team getting together at the same time to talk with the family. They even arranged a time for my brother, who lives in Europe, to be able to Skype in on the conversation. We celebrated Dad's 80th birthday at Scripps Encinitas. They let us throw a party in their outdoor healing garden. They even let Dad have a little bit of chocolate mousse. On July 3rd, 2009, 1 day shy of 7 months, we finally took Dad home. Now, in the beginning, I thought a little cynically that my father was getting exceptional care because I was on television. I came to realize after walking the halls of Scripps at all hours of the day and night that everybody who enters those doors gets treated the same way, with a smile and a hug and a profound sensitivity to the patient and their family, because that is the Scripps way. And that's in part because of our CEO, Chris Van Gorder. Chris actually started off as a cop, but very early on in his career, Chris responded to a domestic violence call, and he was actually pinned in his patrol car by a female suspect who was fleeing the scene of the crime in her car. She smashed into him with her car. He suffered severe injuries, and like my father, he spent almost a year in the hospital recuperating as a patient. So that moment in time changed Chris's life. He left the police force. He went back to college and got his master's in hospital administration. That accident set the course for his second career and his mantra at Scripps to always put the patient first. Now, most CEOs come up through finance or sales, but Chris came up with a very keen sense of who the client is, acutely aware of what it is like to be a patient. And in an organization of more than 15,000 people, I am constantly awestruck by the sense of family. We are a family of 15,000. We look out for each other as family. So when my 11-year-old son looked at me 6 years ago and he said, "Mom, I miss you. I don't like you working till midnight." I thought I have only a small window of time left to be with him before he no longer thinks I'm cool. Perhaps it's time to make a change, or I'm going to have some serious regrets down the road. And judging by his behavior of the past few weeks, that window is rapidly closing because nobody rolls their eyes as good as a 17-year-old boy, except perhaps a 17-year-old girl. Now, I think change is good, but it can also be scary. But then what could be scarier than television news? During my career in TV, I have been shot at, I've been in a hostage crisis, I've been in 3 riots, I've driven through a wall of flames during raging wildfires. I got into the TV business and now the healthcare business because I have a passion for communications. And I'm fascinated by what's going on in healthcare today. The healthcare system is broken. We have to bring down the cost. We have to move from a society that simply reacts to you being sick by ordering up every test in the book to one that actually helps prevent you from getting sick. Now, trying to figure out healthcare reform is like trying to get a good night's sleep in the hospital, right? Ain't gonna happen unless you get some help. And things in Washington, D.C. are so polarized, and as you know, it's kind of hard to figure out the government's latest dance steps because they all keep changing the choreography. What's wrong with healthcare in the U.S.? Well, 1% of patients account for more than 25% of healthcare spending. We spend a staggering $2.7 trillion a year on healthcare, and we really don't have that much to show for it. The U.S. spends an average $8,000 per person on healthcare. The rest of the developed world spends about $3,000 per person. But our lifespan in the U.S. isn't even in the top 20. Folks in Jordan, South Korea, Greece, Denmark, Portugal, Iceland, the Turks and Caicos, they all live longer than we do. In the U.S., a doctor who spends 5 minutes with a patient but puts in a stent to unclog a blocked artery, they get paid $1,500 by the government. But the doctor who spends 45 minutes with the patient and doesn't put in a stent gets reimbursed by the government a whopping $15. It's completely out of whack. And 75% of our healthcare dollars are spent on chronic diseases that can be prevented: obesity, diabetes, heart disease. The healthcare industry is obese. We have to put ourselves on a diet, and I'm not talking about a fad diet. We're talking about a wholesale lifestyle change. We can no longer afford to have the latest and greatest expensive piece of equipment at every hospital. So what we're doing is we're creating what we call centers of excellence across the Scripps system. You might have to travel a little bit farther, but the data suggests people are willing to travel farther if they know they are going to get state-of-the-art care. Our first center of excellence is thanks to the incredible generosity of this man, San Diego's beloved philanthropist, Conrad Prebys, who sadly passed away in July of 2016 after battling cancer. So the Scripps Prebys Cardiovascular Institute, the big building up at I-5 in Genesee that you probably passed by, this is what it was like as it was being built. State-of-the-art operating rooms to handle regular and robotic surgery, all private rooms. It looks more like a hotel than a hospital. Big windows filling the rooms with natural sunlight. Why? Because natural light actually promotes healing. And there's space for your loved ones to spend the night in your room. Why? Because having them there reduces the patient's stress. There's big bathrooms to accommodate wheelchairs and walkers, everything designed with the patient's safety and comfort in mind. If you've got complicated heart issues, this is where you're going to come to be treated. Scripps does more heart procedures than all the other healthcare systems in San Diego. We see more than 76,000 heart patients every year. Scripps has been taking care of Kaiser's heart patients for the past 30 years. And now that the Scripps Prebys Cardiovascular Institute is up and running, we see more heart patients than anybody else on the West Coast. And you know, we do an okay job. Scripps was named again by U.S. News & World Report as one of the best hospitals in the nation for heart care. Best, and I use that word again, innovative. Take the TAVR procedure, transcatheter aortic valve replacement. So this is a new way to replace failing aortic valves like my dad's without the need for open heart surgery. 300,000 people need to have their aortic valve replaced each year. Half of them are too ill to handle open heart surgery. So I watched cardiologist Dr. Paul Tierstein do a TAVR procedure. It's a collapsible heart valve. It's inflated by a balloon. A small incision is made in the leg or the chest wall. The valve is guided up through an artery. We're all watching it on the monitor as Dr. Tierstein moves it into exactly the right spot. It takes him about a half an hour to get it positioned to exactly where he wants it. And then once it is there, what they do is they blow up the balloon and poof. The valve fits snugly into place. It is less invasive, faster healing. You're home in 2 to 5 days. Can you imagine the cost savings in just my dad's case alone? This technology was not available 9 years ago. It's available now. Just ask the 102-year-old man who came to Scripps from Phoenix to have the TAVR procedure. He brought his 67-year-old girlfriend with him. He did just fine. Another center of excellence has to do with the big C. More than 40% of the people born today will be diagnosed with cancer at some point in their lifetime. Scripps treats more cancer patients in San Diego than any other healthcare system. We have 300 doctors system-wide who deal with nothing but cancer. And Scripps has just formed now a partnership with the #1 cancer center in the US, if not the world, the MD Anderson Cancer Center. So we have now become the Scripps MD Anderson Cancer Center. MD Anderson has more clinical trials. They get more funding for research grants from the NIH than anybody else in the world. And so now this is not a clever marketing tool that we have. This is actually a partnership. So what's going to happen is we're going to replicate here across 7 counties in Southern California, from Santa Barbara to the border, from San Diego to the Arizona border. We're gonna replicate what's going on at MD Anderson, and in most cases, once everything gets up and running, and it's going to take us about a year to do this, if you need a clinical trial, and you won't have to go to Houston, Texas to get it. You'll be able to get it right here. To give you some perspective, Scripps has 15,000 employees. We take care of you from head to toe. MD Anderson has 21,000 employees. They deal with nothing but cancer day after day, year after year. So together with this new partnership, we are hoping to make cancer history. We're going to have 2 centers. One will be on the Scripps Mercy campus in downtown San Diego, and the other one will be right here at our state-of-the-art radiation therapy center up on the Torrey Pines Mesa. This was at the grand opening, but you'll see, once again, it doesn't look like a hospital or a medical building. It kind of looks like a modern home. There's lots of open space, natural light, the same team for your entire treatment, which could be up to 8 weeks, because we want this to feel like your second family. And there's a rooftop healing garden where patients and the folks taking them to and from radiation therapy, which could be 5 days a week for up to 8 weeks. This is a place where they can go and kind of relax and try and find some peace in what's arguably the most chaotic time in their lives. And we listen to our patients' needs. So breast cancer patients said the hooks in the dressing rooms were too high. It was too painful for them. So what do? We lowered them. At the Radiation Therapy Center, we have 3D and 4D tumor imaging. Now, 4D deals with motion, okay? So let's say you have a tumor in your lung or your breast. As you breathe, the tumor moves in and out, up and down. Before, we had to radiate an area that was much larger to account for the fact that the tumor would move up and down. Now, with this 4D imaging, as the tumor moves in and out of frame, the machine actually turns on and off. So you get more targeted radiation right to the tumor, but the total amount of radiation is actually 25% less. And we have what's called TrueBeam STX technology. So this delivers radiation to a part of your body that is less than 1 millimeter in size, which is huge when you want to protect the nearby healthy tissue and the vital organs, such as the brain or the liver or the heart. And it takes much less time. My mom, who had breast cancer 18 years ago, used to have to lay still for 45 minutes per session. With this TrueBeam STX, the average time is less than 5 minutes. Talk about increasing the quality of life for our patients. And then there's our Proton Therapy Center. This is in Mira Mesa. So imagine highly energized protons traveling at the speed of 100,000 miles per second to zap hard-to-reach cancerous tumors without destroying the nearby healthy tissue and vital organs. There's no collateral damage, right? So you think of that if the tumor is wrapped around your spinal column or your brain or the breast in front of your heart. Traditional radiation hits the tumor and then comes out the other side. Protons hit the tumor and they actually stop. And all of the rooms have what's called this pencil beam scanning technology. This is where you paint the protons on the tumor layer by layer, no matter what its size and shape. There are only a handful of proton therapy centers in the western U.S. Scripps is the only healthcare system in the entire country with this pencil beam scanning technology in every room. So it's an exciting time, and technology is driving the change that will bring down the cost. Check out this wild ultrasound for your heart. The traditional echocardiogram in the hospital costs up to $300,000, and it takes 45 minutes to do the study. This new V-scan actually sits on your smartphone. It costs about $8,000, and the study takes about a minute. So your doctor can actually show it to you in real time. It's portable. It goes anywhere your doctor goes. Now this device, let's see. See? What a clear image that is right there on the cell phone. How crazy is that? Now this device actually, this checks your heartbeat. It snaps right onto your smartphone. It pops right up on your screen. You will be able to send this anywhere. You'll be able to show your friends, your grandkids, your parents. You can post it on Facebook if you'd like. Or more importantly, you can send it to your cardiologist's office so that if you're lightheaded or dizzy, it'll give your doctor rapid real-time information. In fact, one of our doctors was on a cross-country flight, and you know the story. The PA system, if there's a doctor on the plane, please come to the back of the plane. So he goes to the back of the plane with a couple of surgeons, and they think this guy's having a heart attack, and the surgeons are not quite sure because sometimes indigestion mimics the symptoms of a heart attack. But at 30,000 feet, you kind of want to be sure. So the doctor goes, just a second. He goes back to his briefcase. He takes out the device, puts it up to the man's chest. They see, in fact, that he is having a heart attack, make an emergency landing, take the guy off the plane, and save his life. We're going to just have our cardiologists flying around the country from here on out. Anybody have problems sleeping? Okay, you don't have to admit it. But if you spent the night in a sleep lab at a hospital, it would cost several $1,000s. Whoever gets a good night's sleep in the hospital, right? But what if we hooked you up in the comfort of your own home using wireless technology? So we're doing this right now at the Scripps Prebys Sleep Center. Patients are wearing this patch right here, this multi-sense patch on the right side. It just fits right there on your chest. They're wearing the patch at home for 6 nights in their own bed. You're in your own sheets, your own comforter, pillows. You're relaxed. You're in your own comfortable place, right? And then on the 7th night, on the left-hand side, you're all wired up in the sleep center for, we think we can give you a lot more accurate diagnosis for a lot less money and make you a lot more comfortable. And San Diego is a hotbed for genomic sequencing. Take our North County twins, Alexis and Noah Beery. They were diagnosed with cerebral palsy at age 2. Medicine and treatment, though, didn't work. When the twins were 12, they started having seizures, difficulty breathing, multiple trips to the ER. Alex's skin would turn blue from lack of oxygen. The twins had their genome sequenced, and we found out that they were deficient in serotonin. It is a hormone in the body that helps transmit nerve impulses. So they were given serotonin. What happened? Noah's nausea went away, Alexis is breathing freely, and for the first time in their lives, the twins started moving their bodies with normal, coordinated movement. Genomic sequencing is the window to a brave new world of personalized, individualized medicine, not the one-size-fits-all medicine that we've been used to. Take the blood-thinning drug Plavix. People spend $10 billion a year just on Plavix. Turns out it doesn't work for a third of the people who take it. Scripps was first in the country to come up with a simple blood test that will tell you if Plavix is working with your genetic makeup. And Scripps has come up with what I consider to be one of the holy grails of medicine. It is a test for when you are about to have a heart attack. Everybody remember Tim Russert, the news anchor from NBC's Meet the Press? Tim had a perfectly normal stress test, and then a couple of weeks later, he died of a massive heart attack. Each year, 3 million people go to the ER complaining of chest pain, but all their tests come back normal. But like Tim Russert, they have what's called an incubating heart attack. It is a heart attack that is about to happen. So about 2 weeks before you have that heart attack, we discovered that a crack actually starts to develop in your artery, and misshapen, abnormally large endothelial cells start to pile up on each other and eventually become what could be a deadly blood clot. We now have a blood test which will tell you if those cells are present. But in the not too distant future, let's take it one step further. Let's say you have high blood pressure or high cholesterol. They're developing sensors that will be placed on your chest, like a Band-Aid. And when the artery starts to crack, the sensor will send a signal to your smartphone. It'll go ding, ding, ding on your smartphone. It'll go ding, ding, ding in your doctor's office. And your doctor's office will call you and say, you actually need to get in here right away. And instead of a full-blown heart attack, you will have a stent put in. Spend 1 to 2 nights in the hospital. And in a short period of time, get back to moving at the speed of your life. We're talking about hundreds of thousands of dollars in cost savings per patient. Check this out. This is the e-knee. Scripps is the only place in the entire US testing out this e-knee. It's got sensors inside the knee that's transmitting data on how much stress is put on the knee when you walk, twist, bend, sit, and exercise. Artificial knees last about 20-25 years, but data from the e-knee suggests that your new knee will last longer if you exercise on the treadmill, the stair steps, if you bike. How many of you golf? I'm so sorry. To our surprise, golf actually put more force and stress on the knee. So if you're lucky enough to get a total knee replacement, you might want to reduce the number of times you play golf a week if you want that knee to last a little bit longer. Want to talk high tech? Take a look at this. In 2006, 27-year-old Hermes Castro was hit by a drunk driver. Castro had no feeling in his legs, unable to walk. Thanks to philanthropic dollars, he now has got $100,000 robotic legs. This is the exoskeleton. It's a bionic suit. The rehab center at Scripps Encinitas was the first place in San Diego County to test it out. Scripps is involved in stem cell research, cartilage cells to help arthritis, stem cells in the heart to regenerate a damaged heart muscle. And who knew that a 3D printer could actually revolutionize healthcare? Dr. Daryl DeLima, who heads up what we call SCORE, Orthopedic Research at the SCORE, Shiley Center for Orthopedic Research and Education at Scripps Clinic, is working on using stem cells and 3D printers to actually assemble living tissue. I know it sounds like science fiction, but within a few years, Dr. DeLima wants to have a 3D printer in the operating room and using stem cells be able to actually custom print new cartilage directly into the body, layer by layer, to replace missing tissue that's missing actually because of injury or arthritis. So you think about this, stem cells and 3D printers replacing cartilage so you won't have to undergo surgery for a total knee replacement. It's less trauma to the body, faster healing, it's much less expensive. Now, up until now, healthcare has been largely focused on what's good for hospitals and doctors. But what we're seeing is a long overdue shift to what's good for the patient. And patients who could go anywhere have actually come to Scripps for their care. In 2008, when San Diego State basketball coach Steve Fisher found out he had prostate cancer, he had minimally invasive robotic surgery by Dr. Carol Salem. Steve spent one night in the hospital. He went home the next day. He was able to sit out on the patio with his wife, Angie. Most people never knew that Steve had prostate cancer or robotic surgery. They just knew that he was back on the court to continue his amazing winning streak with the San Diego State Aztecs until his recent retirement. And in the early 1990s, when Mother Teresa needed to be saved, guess who saved her? She could have gone anywhere in the world. She was in trouble. She was sick with pneumonia and life-threatening heart disease. Who took care of her? Look to the left, a slightly younger Dr. Paul Tierstein. At the time, Scripps Clinic was the only hospital on the West Coast testing a new stent that could unclog her blocked arteries. She was secretly whisked in from Tijuana. Dr. Tierstein took care of her heart. She recovered and continued her humanitarian work for another 6 years. Now, every year, Scripps wins a boatload of national awards. U.S. News & World Report ranks Scripps as one of the best in the nation for heart care, diabetes, musculoskeletal issues, gynecology, etc. For years, we've been on AARP and Working Mother magazine's list of the top companies to work for in the U.S. And Scripps has been named again as one of the top 15 healthcare systems in the nation by Truven Health Analytics. Accolades are great, but you've also got to be affordable in this new healthcare environment. So, how do we cut costs? Well, being part of a big healthcare system has its advantages because, like Costco, we can buy in bulk. So instead of a silo mentality that hospitals have always had, and this is hospitals across the nation, what we did was we flipped Scripps on its side, and we're doing what's called horizontal management across the system. So you see it's heart care across the system. Cancer care, neurology, the same for orthopedics, primary care, women's, newborn care, on and on. So what happens when you do this? Well, you actually save money. So let's talk about coffee, okay? Each hospital at Scripps, and other hospitals are now following our lead, but each hospital at Scripps, this is the way hospitals operated across the nation, each hospital was ordering its own coffee from different vendors. No more. We now order coffee for the entire Scripps healthcare system. And when you buy in volume, the price goes down, just like at Costco. How much do you think we save per year just on coffee? Anybody? Oh, come on, don't be shy. How much do you think we save per year just on coffee? 16%. How about a dollar figure? $50,000. Actually, $250,000 a year just on coffee. Let's talk about air filters. We used to purchase from multiple filters from different vendors. Now we're purchasing system-wide. How much do you think we're saving just on air filters? Anybody? 100,000? 300,000? $1.2 million a year. We've also asked our physicians to take ownership of cost cutting without sacrificing quality and patient safety. So we asked all of our heart doctors across the system to look at medication for a certain procedure. There was huge variation. One doctor was ordering a drug that cost thousands of dollars. For the same procedure, another doctor was using a drug that cost $1. So we said to the doctors, look at the data system-wide. What did we find? Without sacrificing patient safety, the results were the same when the doctors used that similar drug, which costs $1. We've also created patient navigators, both inpatient and outpatient. So the patient navigator, who's a nurse, huddles with the doctor and other nurses, therapists, caseworkers before you leave the hospital. And once you leave, you get handed to an outpatient nurse who follows you for up to 60 days after your discharge. So say you had a heart attack. It's traumatic. The old way, we basically said once you left the hospital grounds, we wish you the best of luck, you were on your own. But at Scripps, we discovered actually that patients don't remember what they've been told in the hospital because after all, they've been through a lot. They might be too embarrassed to say they can't drive to the pharmacy to pick up their medication. They're too tired to make follow-up appointments to get lab work done or see their doctor. Maybe they're alone with few friends. They don't have a strong social support system. So now with this patient navigator, they do, because the nurse assesses their situation. Can they afford their medication? How are they getting their meals? Do they need help making follow-up appointments? Do they have transportation to the doctor's office and the pharmacy? What happens when you provide this continuum of care? Well, the patient actually heals faster, stays on their medication, is not readmitted to the hospital, and it's working. But we've also made changes that's going to require a shift in thinking from everybody. In this new environment, more is not necessarily better, which is basically the way we've all operated up until now. So for example, all those x-rays that you want, for your aching back or your painful hip actually might cause you more harm because a lot of x-rays over the course of your lifetime might deliver unnecessary radiation, which increases your risk for cancer. But let's say you have, that aching back and your doctor prescribes physical therapy and you go home and stretch for 3 weeks, chances are your back pain will go away and you will never need the x-ray. Your patients will actually save you money and perhaps enhance the quality of life over the long term. So we as a society must get out of the mindset of getting an x-ray in the morning. You wake up with pain, you call the doctor, I gotta have an x-ray. Getting that x-ray in the morning, I need the results for this afternoon because I need to pop that pill immediately and have all symptoms gone, by the time it's cocktail hour at 5 o'clock. We've also changed the way we do business at Scripps. So let's say you want, so we have 5 hospitals throughout San Diego County. Say you want an MRI and you want it in La Jolla, but you also work downtown. So we now have a centralized calling station and you find out if there's an MRI, you want to go to La Jolla to get your MRI, but apparently there isn't an MRI available for the next 48 hours at La Jolla. But with the centralized calling station, we say there actually is an MRI that's available today at 12:30, and so you can, while you're going to and from lunch at Scripps Mercy downtown, you can have that MRI downtown taken on your lunch break because the hospital's electronic records are connected. Your doctor will see the results no matter where you get the MRI. We've also redesigned our emergency room. So before, when you came in, the receptionist took down your information, and then you sat and waited for the nurse to come and ask you the same questions. And then you'd go back to the waiting room unless you were showing symptoms of a life-threatening illness, and then you would wait until a bed became available. That's okay. Well, it turns out most people who come into the ER don't need a bed. So we reconfigured the ER, we put in a bunch of chairs, and we put the nurse right there at check-in, so you don't need to give the same information twice. Guess what happened? At all Scripps hospitals, the average wait time from the moment you enter the ER until you see the doctor is 30 minutes or less. This is what's good for the patient. It's not about the hospital or the doctor. And it really just makes sense, and it saves a lot of money. The ER folks are, oops. Guess what? Oh, no. I was going to say now it's moving, but it's actually the screen. No, it's not. Can you advance it ahead? It just makes sense because it's part of healthcare reform. And as we talk about healthcare reform, we actually see some emerging trends. Healthcare is going to radically change over the next several years. There is going to be a big primary care doctor shortage. The majority of medical students today are women, and they want more of a work-life balance. So you're going to see primary care doctors doing shifts, 7 a.m. to 3 p.m., 9 to 5, noon to 9, 3 to midnight. I actually picked my son's pediatrician 18 years ago because that Scripps practice was open on Saturdays and Sundays, and as a working mom, that was very appealing to me. In anticipation of the primary care doctor shortage, Scripps has hospitalists now on each floor of the hospital. When you're admitted, these doctors are in charge of you. They see you every day. They communicate with your primary care doctor so your primary care doctor can stay in their office and see more patients. And nurses are going to assume a lot more responsibility. After all, you really don't need the doctor to swab your throat to check for strep infection. A lot more care is going to be given outside of the hospital setting, closer to where you live, work, and play. You've seen all these minute clinics popping up for routine visits and flu shots. There's all kinds of new trends that are starting out. New trends emerging. We're devoting a lot of energy to mHealth, mobile health technology. We're piloting programs that will give you e-visits, virtual visits with Skype, group visits. The doctor might actually see 10 diabetics on the screen at the same time. And in the new world order of healthcare, hospitals are going to partner up. At our Proton Therapy Center, Scripps has formed a partnership with UCSD and also Rady Children's Hospital to treat kids with cancer. I'd like to end with a gadget of epic proportions. I mean, a lot of you folks know, what Epic is. I know that not all of you folks are working with it, but it is the new electronic health record system. It's used by the top healthcare systems in the U.S., Mayo Clinic, Cleveland Clinic, Stanford, Johns Hopkins. It's the best, most sophisticated system for sharing healthcare information between you and your doctors, between your doctors and our hospitals. It's an epic undertaking. It's going to take about a year to get it fully implemented, but it means no more searching through mounds of paperwork. I know that Dr. Sharif, she liked actually writing out the orders, but if we can get it to the point where you're spending actually less time on the computer, spending more time with the patient will have access to their records. They'll be able online to schedule appointments, pay bills, request prescription renewals, review test results, and maybe those of your kids and perhaps your elderly parents that you're caring for. As you probably know, Epic transfers 1.25 million patient records every day between healthcare systems. So if you're in other parts of the country, say you're visiting family on the East Coast, Massachusetts General, Mount Sinai Health System in New York, Duke University in Raleigh, Durham, North Carolina, these hospitals will have access to your medical records. So the country's going to be interconnected, and that is epic news in terms of improving the quality of care for patients. So for my money, I want all the latest gadgets and the gizmos. I want all the technology that we have at our fingertips, but not at the expense of what is equally important to me, and that's the personal connection between me and the folks caring for me and my family and friends. I remember when my dad was in a coma, I would go see him in the morning, then I would go to NBC, I would anchor the early evening shows, I would run home to see my son and husband, I would then run back to Scripps to see my dad, I would anchor the 11 p.m. news, and I would run back to see my dad at midnight. Because there were times in those 2 months when he was in a coma that it was kind of touch and go. And we really weren't sure whether he was going to live day to day, hour to hour. And you know what impressed me as much as all those high-tech machines that he was hooked up to that were keeping my father alive? I was impressed, most impressed, that his heart surgeon was still there at midnight, watching over him. And the doctor and I would sit quietly, and we would talk about life and death, and we would talk about beating the odds. It's that personal connection between doctor and patient and the patient's family. That, to me, is priceless. And that's the way we do things at Scripps. We call it high tech and high touch. We have all the gadgets and gizmos, but we also want to look the patient in the eye. No machines, just that personal connection. And as I said, that personal connection with a smile and a hug and a profound sensitivity to the patient and their families, because that is the Scripps way.
Someday I wish upon a star, wake up where the clouds are far behind me.
All you have to do is look at Nurse Rod Salas. He took up the ukulele so he could sing to patients in the ICU to reduce their stress, to make them smile. He's singing to my mom, who is a very appreciative audience. I remember emceeing an event. And a woman came up to me, and she said, "Do you remember me?" She said, "We spent a lot of time together in the CCU waiting room when your dad was in the hospital." Her son had been in a coma with a traumatic brain injury. I looked at her, dare I ask. She smiled, and she said, "On Christmas Day, my son opened his eyes." I started to cry then, as I do now. Dare I ask, 3 years later, how is he now? She smiled and she said, he's married, and in 3 weeks, I'm going to be a grandma. At Scripps, we treat more than 700,000 people, and we have a story for each and every one of them. Most not quite so dramatic, but each just as important. We have spectacular doctors and nurses and a culture that treats patients like family, not just the patients whose daughter happened to be on TV. And journalists, you know, we're a little bit like doctors. We like the data. We like the facts. I believe the facts are important, and I suspect you do too. And the last time I checked, pigs still don't fly. Thank you.